maybe some of our viewers who aren't from a medical background would kind of be scratching their heads here. It kind of sounds like we're talking about foot and ankle orthopedists who are medical doctors, and quite often doctors of osteopathy go into the same residencies, and then a podiatrist, but it sounds like you're doing the same thing, and they would be right.
Yeah.
There's an overlap there.
Definitely an overlap.
But in addition to doing the surgical musculoskeletal surgery, podiatrists can also do everything else that the foot has to do with. Now, I don't know if you really do that. You do a lot of surgical stuff, OR. Do you even do much that has to do with skin and toenails?
Yeah, I don't do any, we call it routine foot care.
Foot care.
So if patient, sometimes as we get older, it gets more difficult to cut your toenails, trim calluses and that kind of thing. Yeah, I don't do a whole lot of that.
Okay.
I try to focus more on like surgical type stuff. So ankle replacements, ankle fractures, surgical type stuff, the fun stuff.
Whereas at least one of the podiatrists here in Auburn is kind of the opposite. Is that correct?
Correct. Yeah.
So you guys kind of, do you give stuff to each other? And
Definitely.
Okay.
Yeah, we have a similar relationship with a couple other podiatrists up in Grass Valley where
okay.
they like to specialize more in some of the more routine stuff, whereas I like to specialize in more of the surgical stuff between other podiatrists as well as the orthopedic surgeons, which is a good relationship to have for sure.